All right, hi everybody. So today we're still working through approximately 50 active cases in relation to the outbreak here in Shepparton. There has been some more people testing positive overnight and the results of those tests from yesterday and overnight are coming in today. As a result of that, the really clear message we want people in the community of Shepparton to listen to and pay attention to is that if you have not already been tested in the last few days in relation to this outbreak, particularly obviously those people who have been at the listed exposure sites, and if you are symptomatic, even if you haven't been to an exposure site, we want you to come forward and get tested straight away. Please don't delay that. There's plenty of testing capacity right across all of the sites that we have open across Shepparton at the moment and into Mooroopna. The wait times are in the order of about 1 hour or less in some cases. So if you haven't been tested so far or you have symptoms, particularly if you've been to an exposure site, we want you to come forward and get tested straight away. At the moment, there's over 5,800 primary close contacts in relation to the outbreak. The contact tracing team are working through all of the interviews and related inquiries they need to make in order to be able to get to the bottom of what's happening with the outbreak at the moment. Otherwise, in regards to our testing numbers to date, we have so far, since we first learned of the first positive case in relation to this outbreak on Friday, over 12,000 people have been tested across all of the sites in Shepparton and Mooroopna, which is a fantastic effort, and we're really grateful for the support of the community in coming forward and getting tested in that regard. But as I said before, there's still positive cases that are being uncovered. The exposure sites are going to continue to rise. As I said before, there's over 50 exposure sites now. That number will rise. So people need to pay attention to the department's website, keep a really close eye on those exposure sites as and when they're listed and come forward for testing. So if you haven't already been tested or you've got symptoms of COVID-19, please come forward straight away for testing. In regards to our hospital operations at the moment and our other essential services, we have approximately or just over 420 of our staff that are now furloughed in relation to this outbreak. We have managing the support that we need to provide in terms of those essential services by temporarily closing services in some locations and redeploying staff to those critical areas such as our emergency department, our maternity services. Our pathology services are obviously under a fair bit of strain, our imaging services as well as our other bed-based services as well. We're continuing to receive really good support from both the Victorian Department of Health and also the Australian Government as well. So thank you, and I'm happy to take any questions.
In terms of the transmission you're seeing between cases at the moment, is it happening in households, is it the schools? What's that picture telling you?
It's across a whole variety of locations, so there's certainly early on there was household transmission. As things have evolved, there's been really clear evidence of transmission in schools, and now there's also evidence of transmission in retail environments. And I guess that's the thing in relation to the Delta variant. It doesn't really discriminate in relation to where you might have been exposed to someone who has COVID-19. And that's why it's so important that anyone who's been to those exposure sites or has symptoms come forward and get tested straight away.
And in terms of probably particularly more the retail settings, is that kind of, I guess, lack of a better term, the fleeting transmission that they talk about, or is this people that know each other?
It seems to the work is still occurring in relation to the contact tracing, but it's more common where there's people that are placed for a longer period of time than a shorter period of time. And as I was, what I was going to say is, in relation to that, the best way we can reduce the spread is obviously staying home because of the 5 reasons to leave home. But also when you are out and about for those essential reasons, please make sure that you wear a mask, you sanitise, you keep your distance, and also please make sure you use the QR checking code system. Unfortunately, we are seeing some examples where those systems and processes either aren't in place and or people are not following the check-in requirements. All that does is slow down our contact tracing efforts, and really time's the essence at the moment, and we can't afford to have any of those delays.
In terms of more resources being brought in, I understand some ADF will be on site to help out?
Yeah, so this morning we've had a series of meetings with some personnel from the ADF, and later today, hopefully into tomorrow, we'll start to see an increased presence of ADF members coming into Shepparton. Those members will be supporting primarily from a GV health point of view the testing efforts that we have in place across the community. There's also, I'm aware, the ADF personnel that are working with the Victorian Government in relation to the engagement and home visit program as well.
And approximately, do you know how many will be coming to help?
We're expecting, in relation to the testing effort, in the order of around about 50 ADF personnel.
Do you know about those other programs at all? Or?
The home engagement?
Yeah.
So that's a separate program. That's what that is. How that operates is, it's in relation to the Department of Families, Fairness and Housing's authorised officers that are moving around the community. They would typically work in pairs, so one person from the Victorian Department and also an ADF member. And the reason they move around the community is to check on people, see how they are, see if they need anything. For some people, being at home and isolating for a 14-day period can be a challenge, we know that, and that's what really that program's aimed at supporting.
And is there any other resources coming in to help with that testing capacity?
So we're still receiving, still have in Shepparton teams of people from, for example, Bendigo Health, Barwon Health and other health services in rural Victoria. Through the Department of Health's Rapid Response and Testing team, we have people from a range of different private providers that are running and helping assist with the testing that's being conducted at various locations around Shepparton.
And with that high number of staff that are now being furloughed, are you bringing in extra staff as well to help with hospital services?
So we are. We've had some assistance from health services in rural Victoria so far in supplying primarily clinical staff, but the last night there was a request for further assistance that was made, and so far today we've had some contact from metropolitan hospitals, and so far we expect that there'll be some people coming up late today and into tomorrow across a range of clinical and non-clinical areas. So when I say it would be nurses, doctors, but also cleaners, people in our health information team, pathology staff and medical imaging staff as well.
And yesterday the government said that they'd made a link, obviously with the Royal Melbourne Hospital cluster that we've heard of before, but also with Glenroy. Do you have any further information about how that link has been made?
No, not the specific details of how, when and where as such, but absolutely there does appear to be a link between those people that have tested positive in those locations.
How's the response been from vaccine bookings in terms of the hub since the announcement yesterday?
Yeah, so very good response in terms of bookings. I believe there's been pretty reasonable uptake now that the eligibility's opened up to people aged 16 to 39 for Pfizer. It's a really important point though that we do want to reinforce, in addition to all of those measures I mentioned, like wearing face masks and keeping distance and sanitising. The ultimate way we're going to get on top of this outbreak is for people to be vaccinated, and it's really pleasing now to see that there's greater eligibility for members of the community to get vaccinated, and that's what we absolutely want to see. So if you haven't had the chance to be vaccinated yet for whatever reason, or you're unsure, please make sure you check out the information. There's plenty of reliable information on both the Victorian Department of Health and the Australian Department of Health websites about vaccination. Please make sure you access that information from a reliable source, and absolutely book in through the online systems that are available for people to get vaccinated.
So just with those online systems, we've been hearing about people that haven't been able to get through with the systems crashing, and same with telephone. Is Shepparton looking at any different sort of measures to try and combat that, given there's an urgency to get vaccinated here?
The way the system is structured and it works is it's a centralised booking platform, both from a telephone point of view and from the online booking system, and that's managed centrally through the Victorian Department of Health. Usually that system stands up, works really well and is reliable. I imagine it could just be that there's a peak in demand following the announcements that have been made in the last 24 hours or so.
And in terms of the exposure sites, a lot of people are noticing that delay between what goes on the website and that sort of thing. So in terms of trying to get across the most up-to-date information, I guess, is there some work going on to, I guess, shorten that delay so the information can get out on the right sources?
Yes, so as I've said previously, the best, most reliable source of information in terms of the single source of truth is the Department of Health's website in relation to exposure sites for areas that we're really concerned about. From time to time, we are posting information on our Facebook pages that we are particularly concerned about. So I encourage people to do two things. That's keep an eye on our GV Health Facebook pages, but also absolutely the single source of truth being the department's website as well.
In terms of the continued number of cases, do you feel like we're going to see a rise, or do you feel like we're starting to get a grip on the situation here?
It's a bit difficult to say at this stage in terms of what the total number of people testing positive or active cases will be at this time. And the reason is because we haven't quite got the full picture we need in relation to people, in terms of the numbers we would want for people to be tested. And why that's so important is because that will give the medical teams and the epidemiologists the best chance to understand how widespread the outbreak actually is. So again, you know, people really can help in terms of those people who are at home in quarantine, or that who aren't in quarantine but are getting symptoms. Come forward and get tested, because we really need that information to understand what's happening and how we can manage the outbreak, and also in terms of providing further details about the Tier 1 and Tier 2 classification of certain exposure sites.
So just with the people who are quarantining and things, I know there was, especially at the schools, there was a push to get certain year levels and things like that. Can more of the other year levels and their families and things, can they start to come forward now that numbers are dropping back a little bit at the testing sites?
Yeah, absolutely. That's the simple message, is if you haven't been tested and you've been at an exposure site or you've got symptoms, come forward and get tested. We now have 2 of our sites that are open until 8 o'clock at night. So the Shepparton Sports Precinct and the location at Marupna Recreation Reserve are both open until 8 o'clock at night. There's plenty of opportunities now to get tested, not only at those 2 locations, but many of the other locations across Shepparton. And the queues are moving through really well today. The waits are no more than around an hour, I understand, at the moment. So people shouldn't be too inconvenienced, so please come forward and get tested if you haven't been already.
Have those priority people all been tested now?
No, and that's hence the really strong encouragement, and we're urging people who have been to those exposure sites to come forward straight away and don't delay.
And in terms of the number of people you're still needing to get through, I think it was 16,000, 17,000, are we still looking at that kind of number?
Yeah, it's still in that order. It may get a bit higher. There's probably going to be some more exposure sites listed during the course of today, so it's quite feasible that it will move higher than that in the coming few days. And as I mentioned, we've got in the order of about 5,800 primary close contacts at the minute. Good.
With vaccines, I know they were talking about today with the Year 12s especially, got exams and things, will any priority vaccines be given to that year level at all?
Any decisions in regards to eligibility and who's going to move forward for vaccines at certain times is purely a matter for both the Australian and or the Victorian government. That's not a decision that's made locally in any case. So any queries about that would need to be directed to those levels of government.
Yeah. And also, what sort of numbers of people, do you have anything on the numbers of people that are getting vaccinated daily in Shepparton at the moment?
Not offhand, but we're happy to provide that tomorrow. But we do know that there's over 40,000 people that have been vaccinated through our hub. GV Health's responsible for a broader catchment than that through our public health unit for the vaccination program, and we have administered well over 100,000 doses now in terms of part of that vaccination program. So it's progressing along quite nicely, but obviously anyone who's in two minds, please check some reliable information and come forward and get vaccinated.
Yeah. And just on the government list of active cases in Victoria, it was listing cases at GV Health in the dental department, emergency imaging, and I think paediatrics.
Yeah. So those locations that I've mentioned, they're not active cases of GV Health staff. They are more accurately, you could probably refer to them as exposure sites. So unfortunately, we have had examples of where people, before they had a test for COVID and were found to be positive, were in different parts of our organisation while they were infectious. So those areas that are mentioned on the department's website or other areas where it's been reported relates primarily to an exposure site rather than staff that have been positive.
Okay, so patients or?
People that are coming into our health service, yeah.
Okay. Is there anyone in hospital in Shepparton at the moment with COVID-19?
Not that I'm aware of at the moment. We have had some people coming through different parts of our health service since this outbreak started, but there's no inpatients at the moment at GV Health. Okay, good. Thanks. We'll warm up.
Sorry, one more. We heard there was people coming up from Melbourne into the vaccine hubs. Have you heard anything about that at all in Shepparton? Is that true?
From time to time, I have heard there's people coming out of Melbourne to access vaccination. In terms of whether that's occurred recently or not, I don't know. Obviously, you know, we don't want people to be moving around the community unnecessarily, and I guess there's plenty of vaccination sites and hubs available right across Victoria, so people should be accessing one of those hubs that's as close as possible to their home and not travelling, you know, certainly beyond the 5k radius ideally, or if they do need to access vaccination, well, should be the shortest distance possible.